Diabetes may affect the retina by causing the formation of whitish patches called exudates. Other indications may include tiny enlargements of the blood vessels, resulting in microaneurysms and hemorrhages.
A silent killer is on the rise in the U.S. Millions of Americans have been diagnosed, but millions more have the disease and don't even know it. We're talking about diabetes. And according to the Centers for Disease Control and Prevention, it increases the risk of heart disease and complications, including blindness, kidney failure, and amputation. And here to talk with us about the signs, symptoms, and management of this disease as part of our My Health Mondays is Balancing Act health specialist Dr. Sean Caniff. Good morning, doctor.
Good morning. Thanks for having me again.
No, thanks for being here because you always give us so much information. So let's get to the basics here.
Sure.
What is diabetes and what exactly causes it?
Okay. Well, first of all, it's a word that everybody knows, but very few people understand. And as you said, it is on the rise. Listen to some of these numbers. There's roughly 24 million Americans who have diabetes, and 6 million of them don't even know it.
You're kidding.
And on top of that, 57 million people have what we call prediabetes. So they're on the verge of getting this disease.
Unbelievable.
Now, there are two main types of diabetes, but before I talk about those, I'd like to talk about what they have in common, and that's the hormone insulin. Now, the hormone insulin is produced by the pancreas, and what its job to do is to take sugar out of the bloodstream. So you eat a meal, your blood sugar rises, and then insulin brings that blood sugar back down.
Correct.
In type 1 diabetes, which is by far the most rare form of diabetes, it's an autoimmune disease. So the immune system attacks the pancreas. It attacks the cells that make insulin. So they don't have any insulin. So as a result, the blood sugar stays high.
Okay.
Type 2 diabetes, which is overwhelmingly the most common type of diabetes.
That's what we hear about.
Right, and related to the obesity epidemic. Their problem is also insulin, but due to the hormonal influences of fat tissue, the insulin is still present, but it can't do its job. Your body becomes insulin resistant in a sense.
So if it's so common and if it's so much on the rise as you're telling us right now, why is it so missed? I mean, what's wrong?
Well, it's a common misconception and a mistake that people make because if they feel fine, they don't go see a doctor.
This is
and
true.
That's the problem with diabetes. The signs can be very, very subtle. The most common signs are excessive thirst and frequent urination, but you can also have excessive hunger. You can have easy bruising, and your wounds don't seem to heal that well.
Okay.
And then you might have some pins and needle sensation if you have a neuropathy inside the fingertips or more commonly in the feet. So those are all signs. But if you have that excessive thirst and the frequent urination, it might be time for a blood test.
And is that the blood glucose test we were talking about earlier?
Blood glucose looks at your day-to-day variations in your sugar levels, and it's good for that. But it is very variable. It depends on your stress levels, how much you slept, the type of meal you ate, and even in people without diabetes, it can vary very widely. We use another test now called hemoglobin A1C, or just the A1C. Okay. It's just a blood test like the glucose test, but it gives us more of a report card to see how well your blood sugar is being maintained over several months. And that is critical for people with diabetes because studies have shown that if you could lower your A1C level, you might be able to prevent some of the complications of diabetes.
Which is so important. On a personal note, my godfather was actually diagnosed with diabetes, and I remember we got the phone call, and he was really doom and gloom. He was really, really sad, and he just felt like there was nothing he could do to improve his overall health. And what would you say to him and others out there?
You know, that is misconception number 2 with diabetes. We know that losing weight and maintaining a normal weight is critical for people with type 2 diabetes. It could slow down or in some cases even reverse the disease.
So, doctor, diabetes is not solely, controlled through medicine alone, right?
No, it's not. I mean, medicine does help, though. For instance, people with type 1 diabetes absolutely, positively need to have that insulin replaced with insulin injections because they don't make their own insulin. A lot of type 2 diabetics will need insulin injections as well because their body has become so resistant to their own insulin. So insulin can help them too. But not every person with type 2 diabetes is going to need insulin or even need medications. They can maintain a normal weight or lose some weight, maintain a proper diet, eat a lot of fruits, a lot of vegetables, lean meats, fish, and stay away from those cakes and cookies, your simple sugars. So there's a lot you can do. And then there's the nutritional products, like the Glucerna line of nutritional products. Those use a specially designed designed blend of carbohydrates that are slowly digested. Now, the important part of being slowly digested is that it helps prevent those high blood sugar spikes. And if you prevent or at least lower those blood sugar spikes, you'll in turn lower that A1C level, which in the end might help slow down diabetes, or it might prevent some of the complications.
And of course, everything always under medical supervision.
Always do this under medical supervision. The Glucerna line of products are actually medically designed products, and they need to be used under medical supervision.